Hi and welcome to the next day class from your very own Nepali nurse educator. We are on the way now to learn about NCLEX high-yield questions regarding to heart. So today we will be learning about MI, myocardial infarction, which is one of the most common topic in NCLEX. So let's start. Make sure you watch this whole video and understand the topic. If you understand this topic and watch the whole video, I'm sure you'll be able to understand everything about MI. And also you'll be able to answer all the questions related to MI in your exam. So what is MI? Basically what MI means, remember that your heart is not getting enough oxygen, okay? Why this happens? Because your coronary artery is blocked. So remember this line, the longer the heart delay, the more the muscle of the heart dies or becomes ischemic. So remember here, time equal to muscle. The more muscle will die if you waste more time. Even a single minute saves myocardium. Now let's recognize MI. The classic symptom related to MI is crossing or pressure chest pain. The patient will feel like a hard pressure on the chest. And very important, the pain when related to the left arm, jaw and back. Also, you may find some associated symptoms such as shortness of breath, nausea, vomiting, diaphoresis, and patient may become more anxious. Some form of atypical symptoms are also seen in some patients, especially in females, elderly, and diabetic. They may also present symptoms as fatigue, indigestion, mild or no chest pain. Okay. So important point here for exam point of view is that female might have chest pain and no MI. So let's move to the diagnosis. How do we confirm MI? The first step is we do ECG. In ECG, you might find two different features. One is ST elevation. The ST segment will get elevated, which is ST elevation MI. And the next one, ST won't be elevated. Here, ST won't be elevated, you might find ST depression or T-wave inversion. Let's see what is the difference between these two. Think that ST elevation MI means there is complete blockage. Non-ST EMI means partial blockage. But still, it's an emergency and need treatment. So let's move to the next one. It is blood test. Blood test, we look for cardiac biomarkers. Troponin is the most important biomarker here. If troponin is high, think MI. It usually rises in 3 to 6 hours. You can find it peak at 24 hours and it stays in the blood for 7 to 14 days. Next one is CKMB. It helps to detect heart muscle damage. It rises at 3 to 12 hours, peaks in 24 hours, remains for 2 to 3 days. Let's talk about the treatment. Give oxygen if only SpO2 is less than 90% or the patient is in respiratory distress. In relation to the medication, first give chewable aspirin. Give it as soon as possible. And next one is nitroglycerin. Make sure you check blood pressure before giving nitroglycerin. As I already explained in previous drug class, avoid if the patient is in hypotension. Avoid in right ventricular MI and don't give with sildenafil. So next one is morphine. Give morphine if only the pain persists even after giving the nitroglycerin. Monitoring the patient is very necessary. Make sure the patient is under 12-lead ECG within 10 minutes. Continue cardiac monitoring and IV access to give the medications. Definitive treatment is PCI or percutaneous coronary intervention. And next one is thrombolytics. Remember to give within 12 hours, the earlier the better. Remember the contraindication of thrombolytics. To the possible complications, most common is arrhythmias, heart failure, pulmonary edema, and patient can also go to cardiogenic shock. In NCLEX, if chest pain, see first for the ECG. Do ECG urgently. Check for rising troponin. First stabilize the patient, diagnose, and then treat. Thank you, everyone.